What does a typical dermopathology report include? Have you ever wondered what goes into a dermopathology report? This report is essential for understanding skin biopsies, especially when it comes to skin cancer and maintaining healthy skin. Let's break down the key components of a typical report. First, the report starts with patient and specimen information. This includes the patient's name, date of birth, medical record number, the date the biopsy was taken, the body site of the biopsy, and the physician who submitted the specimen. This information is crucial for accurate tracking and clinical correlation. Next, we have the clinical history and information section. Here, the dermatologist or healthcare provider summarizes the clinical background. This includes the reason for the biopsy, any clinical impressions, and relevant patient history. This context helps the pathologist interpret the microscopic findings accurately. Then, we move on to the gross description. This part describes the physical characteristics of the biopsy specimen, such as its size, color, and texture. It may also note how the specimen was processed, including any markings or orientation techniques used to guide the microscopic examination. The microscopic description is where the report gets detailed. This section outlines what the pathologist observes under the microscope. It includes the types of cells present, their arrangement, and any abnormalities like increased cell numbers or abnormal cells. Inflammation and other structural features of the skin tissue are also noted. If special stains or tests were used to clarify the diagnosis, they will be mentioned here. The final diagnosis is arguably the most critical part of the report. This section provides the definitive diagnosis based on the microscopic findings and clinical information. It might identify a benign lesion, an inflammatory condition, or a specific type of skin cancer, like melanoma. If melanoma is diagnosed, important details such as Breslow thickness and ulceration status are included, as these factors influence prognosis and treatment decisions. Additionally, there may be comments or recommendations from the pathologist. This could include notes about margin status, which indicates whether the biopsy edges are free of tumor, suggestions for further testing, or treatment recommendations. This section is vital for guiding clinical management and follow-up. Lastly, if there are any changes or corrections to the report after its initial issuance, these will be documented. This ensures clarity and accuracy in the report. Understanding these elements can empower patients and clinicians to interpret dermopathology reports accurately. This understanding is essential for appropriate diagnosis and management of skin conditions, including skin cancers. Always consult with a dermatologist to discuss the report and its implications for your overall skin health and treatment options.